Number 7, Barbara Stewart.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, is he satisfied with the performance of all district health boards?
Honourable Tony Ryle.
Mr Speaker, I'm happy with and satisfied with the performance of district health boards helping to deliver record immunisation rates for New Zealand children, huge improvement in emergency departments seeing patients within the 6 hours target, record numbers of heart and diabetes checks, faster cancer services so patients don't need to go to Australia, record elective surgery and delivering record access to first specialist assessments. However, there's always room for improvement for district health boards to do better, particularly with regard to the occasional individual unacceptable case.
Supplementary.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Is he satisfied that a 90-year-old woman was kicked out of Tokoroa Hospital at 2:30 a.m. on the 23rd of July, was forced to get a neighbour out of bed to come and return her to her home in Patauru?
Honourable Tony Ryle.
Mr Speaker, no, I would not be happy with that. I would have to check that to make sure that the circumstances were correct. But I can tell you that that would be unacceptable.
Supplementary.
Supplementary question, Barbara Stewart.
Thank you, Mr Speaker. Is he satisfied that a patient being referred by his GP to Mid Central Health for a cardiology test was told by Mid Central Health that he was only a semi-urgent case and that they could not offer him an appointment until January 2014 and instead told him to see his GP?
Honourable Tony Ryle.
Mr Speaker, if that is the case that I think it is, I can advise the member that the District Health Board provided that patient with the incorrect information and they will be getting, I understand, an appointment much sooner than that.
Supplementary.
Supplementary question, Barbara Stewart.
When will we see an end to this treatment of an increasing number of vulnerable elderly patients who, under his watch, have been shunted out of hospitals in the early hours of the morning and into the night?
Mr. Speaker,
Honourable Tony Ryle.
Mr Speaker, I simply reject that claim. The fact is, under our government, we are providing better emergency department service faster. That member only needs cast her mind back to the government that her party supported under Labour, where patients, old people, waited in the North Shore Hospital emergency department for 3 days on end under bright fluorescent lights, and she continued to support that party.
Question number 8, Jacinda Ardern.
Thank you, Mr Speaker. My primary is to the Minister of Social Development and asks, does